Hello, everyone, and welcome to our Friday Fireside Chat. This is the second Fireside Chat that we have initiated as part of a new membership engagement campaign. So thank you so much for joining us. I see that we've got about 8 people connected with us today, and hopefully a few more will tune in while we're chatting. It's very informal, so we're just going to go ahead and get started. So hi, Dr. Breny. Thanks so much for joining us today.
Hi, Heather. Thank you so much. I'm really happy to be here.
Excellent. So just so everyone kind of gets an idea of how this works, I have a handful of questions that we've already gone over, and Dr. Breny and I will kind of run through those, kind of having a brief chat, and at the very end we'll have a little bit of room for question and answer. So why don't we just jump into it? First things first, I'm just going to put up a quick slide to show you all who's speaking. My name is Heather. I am actually the Manager of Membership and Marketing here at the Society for Public Health Education, and we're really excited to connect with you all today. I have the esteemed honor of speaking with Dr. Jean Breny, who is the Professor and Chair of the Department of Public Health over at Southern Connecticut State University. You will see on the slide before you some different ways to connect with her on social media or via email. There will be a few slides that will change throughout our presentation, but if you want to screenshot that or follow up after this presentation, you certainly can do so. So the whole purpose of the Fireside Chat was really to engage membership in a new way, identifying with some of the leaders, thinkers, and doers of SOFI, and figure out a way to personalize our SOFI family a little bit and get to know you a little bit better. So Jean, why don't you tell us kind of what, I guess, brought you to SOFI? How did you get involved in the serving professions in public health, health education, and maybe give us just a little bit of your backstory?
I would love to. Thank you, Heather, and hello everybody who is on the line. This is exciting for me, and it's a place that I never really dreamed of being until just a little while ago. So for those of you who are starting out early on in your careers, you may not think that something like this is what you will end up doing, but I can guarantee you it probably will. So I guess I can start back just really briefly my background. I grew up in Connecticut. I haven't lived here my whole life, but I did grow up here. I was the first person in my family to graduate from college, and that was kind of a big deal, but I don't think I realized as much at the time what kind of a big deal that was. And at the time I didn't really know what I wanted to do. I knew I wanted to go into, as you just pointed out, one of the helping professions. I knew nursing and medicine were not the fields for me. I really enjoyed working with people, talking through things, educating them. One of my first jobs out of college was in a family planning clinic, and I learned a lot there just about misunderstanding of health and misinformation, and also really about the political environment around issues regarding women's health and women's reproductive rights, and I kind of started my work in public health there. After that, though, I realized Connecticut was a little bit too small for me, and there were other places in the world to live, so I moved to San Francisco, and at the time that was a big deal for me. It was 1988, and HIV and AIDS was going strong there, and a couple of years later I found myself entering the master's program in public health at San Jose State University, and I like to say that's where I grew up. Even though I say I grew up in Connecticut, I grew up in capital G, capital U in my master's program. I learned so much about social justice, community organizing. I realized then that I wanted to pursue a career in women's health and reproductive rights, and my internship was at the San Francisco AIDS Foundation, and that was another eye-opening experience for me, working on the AIDS hotline, and again realizing how much we take for granted when you're educated, not just educated, but when you're aware and informed, how many people aren't aware and informed. And again, my commitment to health promotion and health education was reinvigorated then. So after I graduated, I worked in HIV and AIDS in a different couple of counties in California, and then got the urge to continue my education and came back across the country and got my PhD at the University of North Carolina at Chapel Hill, which was another excellent choice for me. And so I guess the rest is kind of history, because from there I came back to Connecticut, got a faculty position, And the leadership positions have just kind of come my way. My SOPHE story starts way back in San Jose in California. I'm sorry, that was the question you asked. I just realized I went off totally off topic. But that's where I started as a student. And yeah, again, it was never thinking I'd be a member now 27 years later. But I've had a lot of different roles in SOPHE. I've been on the board a few times, and a couple of years ago when I was asked to run for president, it felt like the right time. So that's how I got where I am right now.
Absolutely. Yeah, now you're leading us as Board President of the Year, and so that's excellent. I wanted to quickly touch on something that you said. When you mentioned sort of health equity, health disparities, I know you said you were working in San Jose area, sort of San Francisco. Can you tell us just a little bit about that? Kind of explain what that means to you.
My experiences there?
Well, just the work in sort of health disparities. Like I know that that's a big focus for our SOPHE 2020 conference, and so I guess I want to know kind of what your exposure has been to that and why that's an important facet of health promotion and education for you.
Okay. I think there's two answers, two different experiences that I had. And the first one is definitely moving to San Francisco in 1988. Connecticut is, I don't know, a little provincial, and it's definitely a liberal state. But when I was working in family planning at that time, we weren't talking about HIV at all at that time. So when I went to San Francisco, it was being talked about, and it was front and center. And we marched and we did all kinds of organizing around that. One of my first friends that I met, who I actually ended up being a roommate with because he was the boss of a friend, Marty, was the first person that I knew who had HIV, though I didn't know that until he had died. And when he died, his obituary mentioned that he had died from stomach cancer, and his closest friends were very, very clear on the fact that that was not what he died from. But that was my first foray into realizing that something's not right. If people have to hide who they are, hide what their disease is, hide what they're dying from, something is not right. So that's what really first propelled me into health equity and health disparities, and just understanding that there's no reason why people should not be treated equally if they're LGBT or if they're old or young or black or white. The second experience was again during my education, but this time in North Carolina. My dissertation was working with women of color who lived in low income housing, public housing, and the topic was again on HIV and STDs, and understanding as women who slept with men what the social and cultural influences were on their behaviors. And what I learned there again was that there are so many issues around racism, classism, and sexism that affect women's ability to make decisions on their own behalf to the best of their ability. And the inequity of that just makes me want to work harder in that area. There's a lot that we need to do to be, I think we get it in public health, but there's a lot more that everybody needs to do to just really understand that, people need equal access to everything, to information, healthcare, education, and just safety and lives that they can be proud of. So those are the two main experiences I had that brought me to where I am in health equity.
Excellent. Well, thank you so much for sharing. I think those really speak volumes in sort of identifying, the whole breadth of populations and what we do in public health, why it is such a broad sweep to be able to, improve health outcomes. That's really the end goal. So on that note, I know myself, I'm the type of person that will often find an affirmation or a mantra or have someone that inspires me in order to pursue my passions. And so in that work that you were doing as you were going through these different professional and personal achievements, was there anyone that you or now look to, or do you have a particular person that you look up to, or a mentor or a celebrity, anything that kind of helps you stay motivated?
I love that question, and I also have many more answers to that question that we have time for. I think in general, who I'm most inspired by are people who really have fought the fight, either for freedom or equality or justice, knowing the fight isn't over, but they do it in a very loving and very humble way, not the people who are loud about their accomplishments, but the people who work behind the scenes or in front of the scenes, but do it in a peaceful way. And so, Martin Luther King Jr. has always been somebody who has really inspired me. I know that seems really cliche, but I actually just had his I Have a Dream speech framed for my office because it just is a reminder of, there's more work to be done, but there's also a way to do it that's very passionate and peaceful and sweet. And so he's one of the people that I really always go to. And reading Michelle Obama's book last year was inspiring for me as well, as a woman with a background that she has had. And, just people, I'm drawn to people who have a thread through their lives of organizing, of doing the right thing, working with people who otherwise may not have the support they need to fully develop themselves and live fulfilling lives. I'm drawn to people like that. And then finally, I guess I'm drawn to just people who are peaceful. So yogis and Buddhists,
For sure.
and people who are just very sweet. So, just to remind us in daily crazy lives that we have to be in the present that we're in now. So I try to hold on to that as well.
Everything requires balance, right? I mean, you've got to have the push with the pull and everything in between. So I think that that's such a great message because you're right. I think that it's all a matter of kind of making the world go around to find these little moments in between that help us get to our big achievements. So a lot of the people that you mentioned, and I think this was kind of inspired by what you were saying, is, this element of leadership, this element of being someone who is a speaker for a broader population or understanding kind of the goals and the mission of a broader group. And, you yourself have risen to this position of leadership as president within SOPHE. What do you think are specific takeaways or maybe some skills that are crucial to learn before taking on a higher level of responsibility? What are some of the things that you think people should hone as skill sets?
I think, I thought about this a lot because I know we think of leaders as having certain qualifications, but when you don't think of yourself as a leader, but you end up in that position, then you realize what you have to have is really the ability to be self-critical, self-aware, and I do a lot of self-assessments, just to kind of, there's so many things. There's personal coaches, professional coaches. There's all kinds of work to be done to really understand your own strengths because I think especially for women sometimes we don't know that. But I think it's the ability to be self-aware, to act, see yourself from the outside and see how you're going through your day in interacting with other people. One thing that I have not quite learned how to do, but I think it's really important, is the ability to say no. I think we say yes a lot, and the ability to just know what your mission is, what your personal mission is, and if something doesn't fit right, my energy workers, yoga teachers will say, if it's not serving your highest good, then maybe you don't need to be doing that because there's so many things that are going to come your way. And I have noticed that over the past couple of years, there's the more you do in leadership, the more opportunities will come your way because people know you, I guess. And so it's the ability to be able to say no, and that goes back to this being self-critical and doing self-assessments. And I guess the other thing is to be patient, especially with yourself and with other people, is to just realize that, like you said, there's a balance. There has to be a balance between getting things done, but also making sure that people are taken care of along the way. So be patient with the people you're working with and with yourself.
That's perfect. Yeah, I'm going to put some of those notes up as well so that people can kind of take those takeaways with them. So another thing that I kind of wanted to follow up on, as a part of SOPHE, you've worn a lot of hats, right? You've been involved in chapter level leadership. You are now sitting on the board, but you've also had previous board positions. You've been on different committees. So you've worn a lot of different hats in the particular space of SOPHE as a family and sort of identifying what those different needs and strengths are. I'm just wondering, what do you think some of our SOPHE members or even non-SOPHE members, how can they get engaged with some of that? What are areas of entry to be able to grow as a professional, develop professionally and personally? What do you think are some of the entry points for that?
The answer to that is pretty much anywhere and everywhere. What I have loved about SOPHE, which has kept me here for, I can't believe I'm going to say it again, 27 years, but that's crazy. But is that you can do almost anything you want to do within SOPHE. And I mean that, and why I say that is because we're such an all-encompassing professional association, and we try to address and include every idea, every initiative, anything that makes sense within public health and health promotion, which is pretty broad. So I think the way to get engaged is to just start, to realize that it's actually easy to do that. Think about what's making you real. Think about what your passion is. I started on a planning committee because the conference was going to be in San Francisco, and I lived in San Francisco, and it was, as a student, a very easy thing to do. I got on the planning committee, and it was so much fun. It's everything within SOPHE is done by committees who are hardworking people, so you don't have to do the whole thing, right? You're just doing a piece of it because you're working with an awesome team on whatever committee you're working on. So that was how I got started, and it just grew from there. Getting involved at the chapter level is also incredibly easy. That's not the right word, but you're able to do it because it's kind of smaller. It's local,
like accessible.
People in your local area. It's accessible. Thank you for reading my mind. So yes, and the chapters, we have several chapters, and people can get involved at that level. I did that as well. It's a nice way to get involved if you're moving to a new location. I have a student who just graduated. She's moving to Florida. I'm going to put her in touch with the Florida, the areas, the chapters down there to help her kind of get her feet on the ground. Because if there's anything we can say about SOPHE members, we're welcoming and inclusive. So
that's perfect.
Yeah, and
I think that's go ahead.
Yeah, no, I want to. Just the last thing is just think about what your passion is. If you're interested in health equity, we have a community of practice in health equity. If you're interested as a student to be a leader, we have a student position on the board. We have a new professional group. There's all kinds of ways to get involved depending on what it is you're most interested in.
Absolutely. So as you highlighted, SOPHE is an organization that is run by volunteers. We are strongly comprised of the people that are passionate about the work that we do, and that's what helps us get our mission across. So even if we have some small staff and some other folks like myself, I think it is really due to the full weight of the volunteer contribution that allows us to speak so highly in both advocacy, advocating for the profession, as well as more broadly in public health. SOPHE's taken on some different initiatives with REACH and with school health grants, and sort of passing that through to our membership to help identify areas of opportunity and all of these different things. So I think you touched on that so well. One last thing I kind of want to touch on is, as a volunteer, I think people are always looking to find ways to grow personally and professionally. And so what do you think would be the best takeaways for someone from this conversation? What kinds of things do you want to leave them with as a person in the position as board president, and just as someone who's been involved with SOPHE for quite a long time? What are some takeaways for people who are maybe just starting out building their careers as a student or a transitional member, or even someone who's mid-level practicing that's kind of just trying to figure out their next step?
That's a really good question. I think that the first thing is that you too can be SOPHE president or whatever leadership role you want to be. We think of leadership sometimes as a hired position, but leadership isn't only that. Leadership is a lot of different things, and probably everybody on this call is a leader in some way in their lives. But that you really do, that you can have a leadership role if you have that passion to be that. It's not only open to certain people. And to really think about in your lives where the leadership nuggets are. What are you already doing? Is it maybe as a student you are volunteering on the student government, or you are part of Eta Sigma Gamma, or you're an active member in your church? There's probably something in your life where you are a leadership. And to think about, going back to the being critical and doing self-assessments, I'm a real believer in life being about continually growing, nurturing and living your passions. If something doesn't feel right, if it's not bringing you joy, I know there's a whole thing about that right now, but if it's not, to really maybe make a change. And I know a lot of us do this now, but I try to do weekly gratitude and what was it that made me really joyful and happy this past week. And then at the end of the month, go back and look at those again and remember to do those as I go forward, because we lose track of what makes us happy when we get really busy. So to kind of just take a moment and think about what it is that you're really passionate about and go with it, because the world is your oyster, really, and there's all kinds of opportunities out there.
Absolutely. I think you touched on a variety of different pieces that speak to the SOFI volunteer and also to folks looking to get involved in this work. It is so broad, but then I think for myself, growing in my own professional development, that's been what I've loved most about it, is that you get to meet so many people, you get to learn so many new things, and it's really about honing in on what parts of that fuel you and help you identify what are your most important areas that you want to focus your attention. So I think that that's great. So we have just a couple of minutes left, and we're actually going to open it up for questions. If anyone who is on the call has logged in today, or if you're on by phone, you can certainly click in the chat box below. There is a lower left chat box, and you can use that to type in any questions that you may have for Dr. Breny, and we're going to go ahead and open it up. And I know it said on the first slide, but while we're waiting for maybe a couple of folks to share some questions, you gave me the links that you were a part of, but where else can we find you? I know you have an email, and then where else? Are you on social media or different?
I'm trying to, as a Gen Xer, I'm trying to do more with Twitter. I'm on LinkedIn. I think you put the LinkedIn link up there. I am also on Facebook. But I am not, where else am I? Where else should I be? That's the question. Yes, there's email, LinkedIn, and Twitter. And I'm really trying to do more with Twitter because I kind of love the immediacy of it, but also the shortness, the conciseness of it too. So I'm trying to work more with that. Can I, Heather, while we're waiting for questions, if there are any questions, the word that I haven't used yet, which is one of those buzzwords, and I don't know how I missed it, but you gave me the idea of it because I think about how you ended up working at SOFI. It's all about, a lot of this is all about networking. We don't really get where we are without people that we've known. And, way back in my master's program, Dr. Kathleen Rowe was my professor, and she is and was the SOFI president, and she's very active, and she doesn't seem to stop. And you find those people along the way who help you get involved. And she was probably one of the main reasons why I stayed a member of SOFI over the years, because it was an opportunity after I moved out of California, quite frankly, to see her at least once a year at the conference. So you connect with people, you meet new friends. That's how our lives, I think, get bigger and brighter, is with all the people that we know. And not to share your story, but I think it was because you knew our past president.
I did. Yeah, no, you're completely right.
Right?
You're completely right.
So
yeah, no, I was just going to say I'm happy to. No, I'm happy to share. So I completely agree with that. I think it's all about who you know, and you never want to fully, burn bridges if you can try and not do that. You have to grow, you have to learn, you have to go where it's going to be right for you and your family and your choices, and sort of continue that purpose for oneself. But I think for me, I had relocated to the DC area, and I had actually come in contact with Dr. Angela Michelide, who was our immediate past president from SOFI, and we just sort of knew each other through a previous job I was at. And it was so funny because we were at like this little networking ladies luncheon, and she just comes right up to me and is asking me questions, and I was like, oh well, I have a degree in public health. And she goes, oh really? Tell me more. And I told her how I was a CHES, I was connected with NCHEC and the audience there, and she goes, you need to be a part of SOFI, like now. And I just thought that was so wonderful that she wanted me to be a part of
Mhm.
her family and a part of this amazing organization that has so much to offer to the profession. And so it immediately got me roped in, and she stayed connected with me. And it was absolutely through that connection that kind of connected me to where I am today. So I think it's such a good point that you bring up.
Mhm. I think we all have that story. We all have a story like that.
Yeah, for sure.
It's about the
For
people
sure. Right,
that we know.
right place, right time, and those types of things.
Yeah.
Awesome. Well, I
Yeah.
think that we're not getting any questions right now, so that's okay. And I
Okay.
have left up
Mhm.
your slide so that folks can reach
Perfect.
out to you. I'm going to go ahead and end the fireside chat for today. Once again, I just want to thank everyone who joined us for the call, spending your lunch half hour with us just to learn a little bit more about SOFHE and about what we're doing. And stay connected. We want to talk with you. We want to learn more about you and what you're doing. So check us out and let us know how we can do better. And we're going to go ahead and conclude today's fireside chat. Thank you so much, Dr. Breny, for joining us.
Thank you, Heather. That was great.